Welcome everyone. Hello, my name's Emily Abden. I'm ABLE's Hep C Community Campaign Coordinator, and I'll be facilitating today's webinar, which is on international harm reduction. I'll just go through some housekeeping. This webinar is recorded, but only the panelists' audio and video is captured. And also please use the Q&A section to make comments and ask questions. At the end of the sessions, we'll address some of those questions and comments. Now I would like to give an acknowledgement of country. I acknowledge the traditional custodians of the lands in which we meet and live and work. I'm meeting with you all from the lands of the Muwinina people in Nipalina, Hobart, Lutruwita, Tasmania. I'd like to pay my profound respects to elders past, present and emerging, and those that did not achieve elder status due to colonisation. It always was and always will be Aboriginal land. We celebrate the stories, culture, wisdom and traditions of people from Aboriginal and Torres Strait Islander backgrounds, and thank Aboriginal and Torres Strait Islander people who are a part of the AVIL network and community for your valuable contribution that you make towards the lives of our people, our environments and our communities in which we work. I'd also like to provide an acknowledgement of community. At AVIL, we acknowledge the legacy of peers who went before us and those who continue to strive for the equity and social justice in the face of criminalisation. We reaffirm our commitment to work alongside our community of people who use drugs, challenging stigma, discrimination in all their manifestations. So I'll introduce our first panelist or first speaker, which is Dr. Annie Madden. I'll read a little bit about Annie. Annie is the Executive Director of Harm Reduction Australia and a project lead for the International Network of People Who Use Drugs. She is also a principal of Square Pegs Consulting, a health and social policy consulting business. Prior to these appointments, Annie was the CEO of AVIL for 16 years until April 2016 and the Executive Officer of NUA from 1994 to 2000. She's a founding member of Harm Reduction Australia, is well established in relation to people who inject drugs, OST and BBVs, and has held numerous high-level opportunities and appointments. Annie has dedicated her entire professional career to promoting the health and human rights of people who inject drugs. Welcome, Annie.
Thanks, Emily. Thanks, everyone. It's really great to be with you here today. And, especially a privilege for me to be asked to speak at an AVIL event, of course. Before I get underway, I'd also like to acknowledge the traditional custodians of the land in which I'm on today, which is the Boonwurrung people of the Kulin Nation. Like to acknowledge elders past, present and emerging, and also acknowledge that sovereignty was never ceded. I'd also just like to also reaffirm the acknowledgement of community that Emily has just made on behalf of AVIL as well. Now let me just share my screen. Hopefully all of this will do what it should do. How's that? Is that okay? Excellent.
Looking good, Annie.
Looking good? Okay, great. Just gonna make, oh, sorry. Did that just go away?
Not still there, Annie.
Is it? I just lost my own one. So let me just go back to that. Okay, now I'm there again. Okay. So today I'm going to be talking about insights on basically work in the health and human rights space for people who use drugs. I'm going to be talking sort of in two capacities today, and as my Emily's introduced me, and as my titles up there suggest, so I'm talking first about sort of in my capacity as a project lead for the International Network of People Who Use Drugs, or Input, which is a global peer-based or community-led organisation. And then also secondary, I'll talk in my capacity as Executive Director of Harm Reduction Australia. Just want to say up front that all of the work that I'm talking about today is not necessarily led by me or done by me. So I'm sort of talking on behalf of, my colleagues and team members who have all contributed to the work that's being done, some of which I have been involved in or led, and others, other work that's been done by others. But it's more to give you a bit of an overview of some of the work that happens in this space towards these issues. So in terms of that, what I'd like to do is start with the sort of part one that will focus on Input's work. And in particular, I'm going to really focus on Input's rights-based advocacy in the sort of UN human rights mechanisms. I felt that might be something interesting for people to hear about at the global level. It's often something I just know from my own work in Australia, don't necessarily get an opportunity to kind of be in those global forums or understand how they work. So hopefully that's interesting for people, and I can sort of explain a little bit about how Input's making the sort of use of those opportunities, if you like, to sort of showcase and foreground the health and rights issues for people who use drugs globally. And then in the second part, I'll focus on Harm Reduction Australia's work more within the Australian context, and just look at some of the submissions and reports that we've been doing that are on the topic of health and human rights in the Australian context. And then happy to take questions and whatever after that. So to get started in terms of Input's work, it's probably fair to say, I think, that most of Input's work as a global organisation is rights-based advocacy of one kind or another, because, it's not a service delivery organisation, and probably the closest Input gets to that kind of, direct frontline kind of work is to kind of doing sub-grants to our network members regionally, at the regional level or at country level, to support them in providing frontline work. But Input doesn't do that work itself as a global organisation, of course. So most of the work Input does could be defined, I think, as rights-based advocacy. A lot of that work has traditionally kind of focused around the UN Commission on Narcotic Drugs, or CND, which is based in Vienna. And I've just put an example there of the sort of most recent CND, where we actually ran a human rights focused event, and in collaboration with many others, as you can see in the top of the flyer there. But that's traditionally been a lot of where we have focused our human rights work. But I'm sort of not going to talk too much about that. A lot of that is online and available in videos and other things, because that work is kind of recorded a lot. But it's really important work, and it has, as I say, been a bit of a mainstay of where we've been raising these issues. But over the last few years, Input has really started to focus more of its attention in some of the spaces that perhaps haven't been such a focus for health and human rights issues for people who use drugs. And that's really more in the Geneva space, as opposed to Vienna, where the CND is. And Geneva is where the sort of UN human rights mechanisms kind of are based or operate out of largely. So it's why I'm sort of calling it sort of Geneva-focused work. In particular, some of that work has focused around the Human Rights Council and the UPR, or the Universal Periodic Review process, and I'm going to talk about this a little bit in a minute, and also in relation to some of the what are called treaty bodies and their review processes. So some of those treaty bodies, which you may have heard of perhaps before, is Committee on Economic, Social and Cultural Rights, or CESCA, it's called for short, the Committee on the Elimination of Discrimination Against Women, or CEDAW, and also the International Covenant on Cultural and Political Rights. They have a Human Rights Committee that is a treaty body that sort of oversees the that particular covenant. Um, Next. So I just thought I might just, explain to people a little bit how all of this kind of works and operates together, because I think this is the piece that maybe isn't as familiar to people, perhaps. So as you can see at the top there, there's the UN, the United Nations General Assembly. That's, where all the member states, all 193 of them, including Australia, sort of are part of that, the countries of the world that are members of the UN, which virtually all of them are, come together to, they make resolutions and draft treaties and things like that. So on the treaty side, I'll deal with that first. So the UN doesn't, adopt treaties. What they do is they draft them. They draft treaties on many, many topics, including things like, disarmament and genocide and the environment, but also, of course, on human rights. So that's how the sort of treaties come to be in existence, if you like. This is a very basic understanding of this too, by the way. I'm by no means an expert on these things, so there might be people online who can add even further or correct me on things. So then once the treaty is drafted by the General Assembly, it basically is up for member states to adopt or not those treaties. But once a member state adopts a treaty, they are bound by it. And there is an expectation, at least, that they will enshrine the principles and that are contained in those treaties into their own domestic law and action them, therefore, in the everyday lives of their people. So one of the things that is sort of the focus for today, of course, is the human rights type treaties that have been developed. And there's various treaties, as I've sort of mentioned in the previous slide, and they are basically monitored for compliance. Once a country or a member state has signed up to them or acceded to them, then they are monitored by these treaty bodies, and they have review committees and review processes to sort of monitor how member states are going on meeting the what's laid out in the treaty, in their kind of laws and their practices. So that's the treaty side. The other thing the General Assembly does is they pass resolutions on all, manner of things. It's, pretty endless. But once they've created a resolution at the General Assembly level, so for example, for this presentation, one example would be the Universal Declaration on Human Rights, was a resolution of the General Assembly. And to sort of give effect to that, if you like, they set up the Human Rights Council in 2006. And the thing that sort of distinguishes, if you like, between the human rights treaties and the Universal Declaration of Human Rights is, as I said there, the declaration covers all human rights, right? Not just the kind of specific issues that some of the treaties might delve into around economic, social, or cultural rights, or that sort of thing, or political rights or something. The declaration is about protecting all human rights broadly, and the way that they monitor compliance with the declaration is through what's called the Universal Periodic Review Process, or UPR. And that's basically a kind of peer-reviewed process where other member states are part of assessing the human rights record of all other member states. And this is where civil society and community can have input, and I'll come on to that. The only other sort of piece that I think is really worth mentioning is there's this kind of on the sort of resolution side, there's also this sort of special procedures part, and that is where you may have heard of before of like special rapporteurs on different issues, and that's kind of where they're kind of created. They're usually roughly 3-year terms. They're individuals usually who have real standing on an issue, and they're usually thematic based or sort of country issue based. So it might be You've heard of perhaps special rapporteur on the right to health, special rapporteur on the rights of prisoners, special rapporteur on sort of the rights of Indigenous people. So they often travel around, and they'll, speak to countries, or they'll come with a list of issues to countries or a particular country, and they sort of try and sort of advocate for countries or member states to sort of do more or better on particular issues that they are covering. So that's the kind of general sort of lay of the UN human rights mechanisms. And I've just put up in the corner there that the office, the OHCHR, which is the Office of the High Commissioner of Human Rights, they basically, you may have heard of them before, or that person before, but the Commissioner and the Commission basically sort of oversee all the work of the Human Rights Council and the special procedures. Now, I want to come back now and focus on the sort of the UPR, which is the Universal Periodic Review, and this is where the Universal Declaration of Human Rights is monitored, basically. And as I say there, it's a human rights mechanism that monitors, analyzes, and highlights human rights violations by member states. It's a cycle, and it's a peer review process. So basically, member states undergo a review process by other member states and civil society and community as part of that, to review their human rights record. And this usually happens in a kind of like 4 to 5 year, 4.5 year cycle usually. So and that's because there's 193 member states. So they do roughly 43 countries per year over that 4.5 year period. And that gets you to 193 countries that are all reviewed in the cycle, right? So everyone gets reviewed. And under that review process, member states basically they submit a report. If they're under review, they come up for review in sort of cycles within the larger cycle, and they submit a report. And at the same time as the member states submitting a report, there's also an opportunity for civil society groups, including community, to submit what might be called a shadow report alongside the reports of the member state. And during the UPR review cycle, the state under review will receive recommendations from the UPR process to identify any human rights concerns, and then they're usually tasked with adopting these recommendations through their policies and laws before their next review process. As it is with a lot of this sort of international advocacy and international law, people who are familiar with international law will know this. It's not as if there's kind of like some big stick that can be used to make member states do things. It's really a peer review process. It's that kind of pressure of your peers, if you like, to kind of if you've agreed to do something, to do it or to do better in this space, there's it brings pressure to bear. But of course, there's a limit to what can be done to make countries comply. But it is with that said, it's a relatively effective process to bring the spotlight on. It is a chance to highlight things, at least it gives that. And there have been positive outcomes from the UPR process because it is respected. And so countries obviously don't want to be seen to be doing badly under this for the most part. So I want to just sort of, with all of that information in mind, I wanted to sort of talk a little bit about some of the work now specific work that Input has done to engage communities in those UPR mechanisms. It can, this UPR mechanism, because as I've explained, it can be a really useful mechanism for communities, and particularly communities of people who use drugs, because it is a mechanism for potential change. And it also provides a tool to kind of measure the progress of human rights issues and whether they're improving or going backwards over time. So it's useful for that as well. And as I say, it gives an opportunity for communities to really formally call out injustices and violations. So very useful in that regard as well, but also tricky for some communities, as you can imagine, particularly in politically volatile or really repressive environments. It can be really difficult and dangerous for communities to call out their country government on these kinds of issues. And this is where I guess the collaboration between Input and the regional networks of people who use drugs, of which there are now 8, there's a regional network of people who use drugs in all the regions of the world that sort of covers all parts of the globe, if you like. And then there's, of course, a growing number of country-based networks of people who use drugs, and then locally as well. So those kind of networks and collaborations also provide mechanisms from which issues can be raised, perhaps on behalf of communities if they feel it's a particularly vulnerable or difficult for them to raise them. And I really can't understate this issue enough, really. In my PhD, in fact, which was on drug user representation in high-level policy environments, so these very kinds of environments. And I talk in my PhD about just some of the kind of risks and some of the kind of implications of people who use drugs standing up in these forums or putting words to paper in reports on these kinds of issues. And people have literally had come home from some of these high-level environments, activists, and had authorities at their door pursuing them, had to leave their home, their families, their jobs, everything, and flee to another country to be safe. It's serious stuff, and it's difficult work. And I really commend the people who take this up. Anyway, so towards doing this work, Input has conducted quite a large body now over a number of years of advocacy training with regional and country networks to sort of build people's capacity to engage with these mechanisms, because as you can see from what I've just explained to you, this is reasonably complex. There's lots of different sort of committees and processes, and they're very formal, and they have lots of kind of real ways of doing things that you have to adhere to, or it's not going to be heard. So they're doing training around all of that has been a real focus for Input. I've just put one of the resources up there that is the Universal Periodic Review, how people who use drugs can engage and impact state reviews. That's available on the Input website. And there's also a webinar that goes with that I really encourage people to look at if you're interested in engaging in UPR mechanisms. Just to kind of very quickly go to some of the examples where we've worked with country partners on this. So, we've done a lot of partnerships with a lot of different country networks and regional networks now, but recently Nigeria, Nepal, and Kenya have been some of the countries we've worked with to put in shadow reports to UPR processes. And, together we've worked with them to understand the process using those technical kind of guidance documents and trainings that I've talked about, assisted in sort of community consultations and focus groups, and helping communities to collect evidence to go into their shadow report at the country level. So supporting people's work and capacity building around that, helping to draft and then submit the shadow reports as well. So helping to edit and proof reports and all of that sort of thing. We've also, as the photo sort of suggests there, assisting with attendance at actual UPR pre-sessions and sessions. So there are actual meetings where communities can and do attend to speak to their shadow reports and put things more formally on the record in those pre-sessions and sessions. We also do follow-up advocacy with member states. So once the UPR process has happened and there's been findings and recommendations, we work both as input and with our members to do follow-up advocacy, and also supporting our members and input itself to attend Human Rights Council sessions, to really just continue the advocacy work and to make interventions on an ongoing basis to really keep these issues on the agenda. Just finally, to give you a bit of a sense of some of the issues that might be raised in these UPR shadow reports. So not surprisingly, the ongoing use of the death penalty for drug offences, illegality and criminalisation of drug use, drugs, drug use, and people who use drugs, incarceration and prison conditions issues, issues around routine experience of arbitrary arrest and unlawful detention, police abuse and harassment, law enforcement issues, and in particular issues with law enforcement involvement in corruption has been a big focus of several reports. Lack of access, of course, to medical services for drug withdrawal during detention, inhumane and degrading treatment in compulsory and coercive detention centres, particularly in certain regions and countries. The general lack of implementation of harm reduction services and issues around stigma and discrimination in health settings is raised a lot, as you can well imagine. And then the lack of accountability of member states to oversee services and prevent violations. And I just wanted to make the point. So there's sort of some of the issues specifically in relation to drugs, drug use, people who use drugs, but there's also, you know, wider human rights violations and the intersectionality of issues that gets raised around sort of gender-based discrimination and racial discrimination, LGBTQI rights as well. So just, you know, those kind of wider issues. But that's some of the sort of things that you might expect communities to be raising in these shadow reports. I want to move on now to talk on the other side of my mechanisms example, and to look a little bit at the treaty bodies work, because Input has also been doing quite a bit of work on that side of things as well. So first one is CESCA. So that's the Committee on Economic, Social, Cultural Rights. And it's a human rights treaty body that's responsible for the monitoring and implementation of the International Covenant on Economic, Social and Cultural Rights. And interestingly, in 2020, late 22, 23, CESCA, which is the committee, announced that they were developing what they call a general comment on the impact of drug policies on ESC rights. And this is really important, but I'll come back to why. But first, I just wanted to sort of talk a little bit around what are economic, social and cultural rights, because maybe that's very apparent to people, but I wasn't entirely sure. So, you know, basically, you know, if we look at economically, we're looking at things like the right to employment, the right to fair pay, the right to, you know, to freedom from poverty, you know, social security rights, those kinds of things. If we're looking socially, we're looking at, you know, right to housing, right to food, you know, legal rights, the right to education, those kinds of things. Culturally, you might be looking at, you know, freedom from racism and the right to cultural identity, those kinds of issues. And then in terms of drug use, I think one of the things that we've focused on a lot in this space is the kind of right to bodily integrity and the freedom from coercive treatment. So they're two that specifically we've been raising in this space around people who use drugs. Now, as you can probably appreciate in that sort of context, you know, it is really important that this CESCA has decided to focus on the impact of drug policies on these kinds of rights, because as we know, as people who use drugs and people who work with people who use drugs and provide services, etc., it's you know, there's a lot of violation of economic, social and cultural rights for people who use drugs on a daily basis. And so when the CESCA says we're going to do a general comment, what that does is it sort of elevates the obligations of states to ensure whatever the focus of that general comment is that they are doing everything they can to ensure that economic, social and cultural rights are not being negatively impacted. So if they're doing one on drug policies, it means that it puts front of mind for member states that they do need to be cognizant and looking at their drug laws and policies in relation to economic, cultural, and social rights. And because often, otherwise, if you don't have that kind of focus, then, so once a general comment is made by SESCA and approved by the committee, it means that whenever their member state reviews come up through SESCA, this will automatically be included in the review. If it's not a subject of a general comment, it kind of can be a little bit more ad hoc. It may or may not come up, so this is really important, a really important development that the committee itself have identified this as a key issue. Towards this work, in early 24, Input held a global consultation on the impact of drug policies on the SC rights of people who use drugs. The report I've got there on the side, it's available on the Input website. It's in English, Spanish, Russian, and French. We've used the report already to advocate to the chair, or with the chair and the committee that are working on the general comment. And really, I worked on this report directly, and to my mind, it really is the first time that I'm aware of a document, a global document that really starts to try and document the impact of drug laws and policies on the economic, social, and cultural rights of people who use drugs. It goes much wider than many documents that we would typically see around drug user rights. And we're currently waiting for the next stage of the general comment development process. The committee has developed a draft general comment, and we've provided further comments on that. But I have to just caution that at this point, we are a bit concerned that this process might stall. The committee is really under-resourced. There are good people heading up this work who are very committed to it. But SESCA, as you can imagine, covering economic, social, and cultural rights, has a huge kind of agenda of issues that they're always undertaking. And it's very easy for issues to kind of be a priority, but kind of fall off the priority list before things kind of get fully progressed. So we've kind of hit a bit of a stall on it. I'm hoping this work will continue and we will see a general comment eventually. We are certainly advocating for that, but it's a bit of a watch this space. I also want to just talk about the treaty bodies in relation to the Committee on the Elimination of Discrimination Against Women. They are responsible for overseeing the convention in this space, which is the Convention on the Elimination of All Forms of Discrimination Against Women. Input, as you can see there, has also done a technical brief on this issue. Again, commend that to you. It's really easy to understand. It's a really practical guide that really empowers drug user activists, and particularly women who use drugs, to assert their rights in this space. So do take a look at that. It's available in the languages that you've got there, English, Russian, Spanish, French, and Spanish, which are, by the way, are the languages that Input will, resources permitting, typically we'll produce our resources in as a minimum. Depending on who's involved, we may, and resources, we may do other languages, but we try to keep that as our minimum. This is, and I wanted to use this example because it is such an inspirational example. So women who use drugs in Kyrgyzstan, they have done a shadow report on their experience of, sorry, not a shadow report. They've done a report on their experience of writing and working on a CEDAW shadow report. And this case study, it sort of documents their experience of Kyrgyzstan and women in Kyrgyzstan, and it's done by the organization called Hysteria, which is led by women who use drugs, and they wrote and submitted a shadow report to CEDAW. And I say it's inspirational, and in part that is because, not just because it was done, that's inspirational enough in itself, but it also resulted, they were able to successfully get a recommendation on decriminalization in Kyrgyzstan, on decriminalization of drugs in Kyrgyzstan from CEDAW, based on the work they did through submitting this shadow report. So I think it's a real resource for other networks of people who use drugs who are considering engaging with CEDAW itself, but also any human rights mechanisms. It's just great. Again, because of the sort of focus of this is just in English and Russian, but it's really great resource. Nearly at the end here, just one of the other things for Input's work, one of the other things I just wanted to focus on is this resource that Input has done as well. This is around it's called the Fight for Accountability, the Right to Rights, and it really documents sort of all of the human rights mechanisms, how they're relevant to people who use drugs. It cites specific cases, and, you know, I really think it's a very useful resource for people who are interested in sort of getting involved in this sort of work. Again, it's on the Input website. Have a dig around there. There's lots of great stuff on there, but in particular, there's a lot of and a growing set of resources around human rights advocacy for people who use drugs. Okay. So that's a bit of a quick whip around. And honestly, that is just a sort of fraction of the work that Input has been doing in this space recently. The work goes on. There's a great deal more happening, and we can perhaps talk about more of that depending on how time goes. But I do want to focus as well on my other passion in life, which is my role as Executive Director of Harm Reduction Australia. And just before I get into the work, I think it's important to contextualize Harm Reduction Australia's work, because some people know this, but some people I think do not. Harm Reduction Australia doesn't receive any government funding of any kind. That's a conscious choice by the organisation. I don't say that as some kind of, you know, to brag or something. I say it because it's a political choice. It's a choice around we really wanted to be able to be free to speak and say what we need to say. And many of those involved in HRA are quite experienced and have a lot of experience of how much government funding can curtail what you can say, not always, but can have that effect. So we opted not to do that. At least for now. I never say never, but that's where we stand since we started till now, which was 2015 when we established the organisation. So it's an national advocacy organisation, a broad harm reduction organisation. And we're really just looking to advocate for harm reduction and drug law reform, meaningful drug law reform. We see drug law reform, and our position is legal regulation is part of harm reduction. And so that's where we stand as an organisation. And so our work, you know, all of the work we do is through raised funds, other than government. And so as you can imagine, that's not a lot of money in Australia. It's pretty difficult to raise philanthropic funding in Australia. So I think, you know, really do a lot with the small amount of funding that we have. And we have a very small team, and we rely a great deal on volunteer work, which I'll come back to. So in that context, and with that said, some of the work that we've been doing in the human rights space specifically over the last few years mostly involves sort of submissions. So we've done submissions into the inquiry into Australia's human rights framework. We did a report or submission to the Special Rapporteur on Health, on the right to health framework on harm reduction. I spoke about the special rapporteurs earlier, and we also put in a submission to the special rapporteur on torture as well when that opportunity arose. And we more recently, one of our more recent submissions was to the Federal Parliamentary Inquiry on the impact of AOD in Australia. Of course, that wasn't human rights focused specifically, but we did include quite a large section in there on human rights issues. So all of those submissions can be found on the HRA website. I've given you a link there, but under submissions, there's that and a lot more that we've done in that space. I just wanted to give you a sense a little bit of some of the sort of issues that we might be sort of talking about in those submissions in a kind of more Australian context rather than global as I've been speaking to date. So, we're, as I said, really interested in the sort of intersections between harm reduction, human rights, and drug policy. And in our view, harm reduction is really principally concerned with upholding and protecting the human rights of people who use drugs, and in particular, the right to the highest attainable standard of health for people who use drugs. So in that context, some of the issues we've raised in those submissions I've just listed are things like problems with access and gaps in coverage for harm reduction. So drug treatment, gaps in coverage, especially in prisons, access to naloxone and take-home naloxone, access, the lack of drug consumption rooms in Australia, which is appalling still. A particular passion of mine is the lack of the urgent response to the escalating overdose deaths in Australia. There's virtual silence on that issue for reasons I cannot fathom, despite the amazing work of Avel and many others in this space. We don't seem to be able to get attention on this issue. I have my own thoughts on why, but it is something we continuously raise as needing urgent attention. Of course, the use of drug detection dogs and strip searches in public spaces and events. And I'll just sort of say, in addition to raising in these submissions, we have a whole report coming out on that particular issue soon. So watch this space. Discrimination and human rights issues around roadside drug testing, in particular around medicinal cannabis, which is one of our sort of core project issues. Of course, the lack of NSP in prisons in Australia. I mean, this fundamentally goes to the principle of the right, to health, and also the principle of equivalency in prisons. There's meant to be principle of equivalency at work, which means that prisoners must have access to equivalent level of services to that in the community. We all know we have NSP in the community. We don't have it in prisons. Australia is signatory to international human rights conventions and covenants that cover this, but are not doing it. Human rights violations associated with prohibition and the ongoing criminalisation of drug use, of course, personal use, possession, low-level supply, the need for legal regulation of all drugs to ensure safe supply. And we also raise issues such as, stigma and discrimination, how pervasive and entrenched that is for people who use drugs. And again, we also in these submissions bring up the intersectionalities between racism and prohibition, gender-based violence and prohibition, and economic, social and cultural rights and prohibition. And finally, we often raise the issue of there's a real lack of clarity in Australia across the jurisdictions on the Good Samaritan laws in many jurisdictions. They do not protect people who use drugs. So that's another sort of human rights type context issue that we regularly raise. At just a more of a kind of system or policy level, one of the issues that we've been raising in some of these submissions is the complete lack of any reference to human rights as a fundamental principle in our national drug strategy. We've advocated for this to be addressed in the next national drug strategy. We raised it again in the recent AOD inquiry submission that I mentioned before, and we'll continue to raise it at every opportunity. I've put a quote there from the Australian Civil Society Committee on UN Drug Policy that HRA is a member of. We provide advice, and Avel is as well. We provide advice to the Australian government on their work in the context of the C&D, but the UN generally. And it just sort of says, it all there really, that having a national strategy on drugs that is blind to human rights consideration creates a space for governments to breach citizens' human rights in the name of drug policy, and they happily do so, really. So I think it is so, so important that this issue is addressed, and we should all be advocating for that. I just wanted to sort of also touch on some of the human rights issues that HRA has raised in submissions that really go more to the global context rather than what I've mentioned to date for HRA is more, these are the issues we think are live human rights wise for people who use drugs in Australia. But there's also global issues. So we consistently try to raise the need for the abolition of the death penalty for drug offences. This is still used in 35 countries around the world. So we try to include that in submissions wherever possible. We regularly advocate for the human rights of people all people, not just Australians, but all people on death row, including signing letters whenever we can to governments. Others, organisations, including AVIL, do this work as well. But we try to call out the lack of transparency and accountability in the information that the Australian Federal Police share with other countries, some of whom have the death penalty. This is a real problem in the space, and I think, again, something that as Australians we need to be really aware of, that we proudly say, rightly, that we've abolished the death penalty and we have no we do not support the use of the death penalty in any way. But the fact is while there are formal agreements in place for the AFP to be sharing intelligence and information in a very untransparent, is that a way word, and unaccountable way with countries who do have the death penalty. The Bali Nine is a very, very now well-known example, but it effectively becomes, death penalty sort of by the back door, de facto, and it's serious, and this needs to be addressed. But the AFP are very powerful, so getting that addressed is easier said than done. Advocacy against the continued existence of compulsory and coercive detention centres, particularly in Asia, but not only. And they engage in appalling human rights abuses, including violence and torture, physical and psychological abuse, unlawful detention, unpaid labour. These centres still exist, and it's kind of gone off people's agendas a bit. Not everyone's, of course. We try and raise it. Others do try and raise it, but it's really just appalling that these centres in 2025 are still an issue. I just want to finish actually on some work that we've just sort of done in partnership with others. So it just so happens that Australia is scheduled for review, actually, as we speak, by the Human Rights Committee, which, as I said before, is a treaty body that oversees the International Covenant on Civil and Political Rights. So HRA, along with other civil society and community partners, including AVIL, we made a joint submission to the Human Rights Committee just very recently to monitor Australia's compliance with the ICCPR. And it's just so you know, Australia became a signatory to the ICCPR in 1972, but it is still, in 2025, yet to fully enshrine the ICCPR into domestic law. That means there are significant gaps in their compliance with this covenant that they say they are a signatory to. So Australia submitted its periodic review report to the committee. Our submission will contribute then to what's called a list of issues, so that the committee will put together a list of issues for Australia to respond to, and then they'll meet with the Australian government to discuss that list of issues and their response to them. And that, of course, provides a chance to improve compliance on that. And what issues did we raise in that? Well, we raised the fact that Australia, it doesn't have a Human Rights Act of any kind. Neither does it have any constitutional protections in terms of human rights. Unlike other Commonwealth countries, Canada being a notable example of this, that has significant constitutional protections, and they have been successfully used by community, by people who use drugs in Canada to fight for their right to access life-saving services, such as the safe injecting room, for example, and heroin prescriptions. So this is really important work, and it is really unacceptable that despite inquiries and many reports and too many conversations on this issue, we still do not have either a Human Rights Act or any constitutional protections. We, of course, have punitive drug laws that routinely infringe human rights, and we raised this significantly in the submission. We also raised the disproportionate impact of current drug laws on Indigenous communities. We raised again the issue I've just talked about with the Australian Federal Police cooperating with other law enforcement agencies in countries with the death penalty. We raised again the issue of arbitrary and coercive detention, particularly the coercive compulsory detention centres in the Asia Pacific region. We highlighted conditions of detention and the rights of prisoners. the use of sniffer dogs and strip searching, and the rights of people who use drugs to participation in public life, freedom of expression, access to information, and freedom of assembly, all of which are compromised by number 2 on my list, and probably number 1 as well, really. So look, there's a lot of work that has already been done, both by Input and its regional, country, local member networks of people who use drugs, and by organisations in Australia, including Harm Reduction Australia, AVIL, and many others in this space. It's ongoing work. As I've said, it's difficult work to progress. It's such crucial, it's really critical work, but it's for some of the reasons I've already articulated, it is extremely difficult to have wins in this space, but we need to prevail. We need to continue to do this work, in my view. So I think with that, I'll say thank you for listening to me for all that time on all those things. I do, just before I finish, I really do feel I want to acknowledge some of my colleagues in particular, because as I said, this is not my work. This is I want to, of course, thank Abel for providing the space to talk about this today, but I want to acknowledge my colleagues on the team at Input. It's a small team. Anton Basenko is the new executive director, is amazing. Ukrainian drug user activist, has recently joined us, following outgoing executive director Judy Chang, also has done and led a lot of the work that I've talked about today. Olga Schubert, Adisha Taslim, who's from Indonesia, and he leads a lot of the work in the Geneva space for us, and Isaac Urgankola, who is new to Input, but he has been leading a lot of work with his some of the African networks and with Adisha in Geneva. So just wanted to specifically name them. In terms of HRA, I really need to obviously acknowledge my colleagues, Gina Vumbaka, Stephanie Zanitas, and Erica Franklin, who we're the team at HRA. And also I really do need to shout out to Penny Hill, who's a board member of HRA, and she has really led that last submission on the ICCPR submission on behalf of civil societies and community in Australia. So huge amount of work, and she does a lot of work in this space. So I really want to mention her. And I'll leave it there. So thank you. Thanks again.
Thanks, Annie. Oh, wow. Yeah, I have to echo those sentiments, especially about the Input team, Annie, because, I had the privilege of briefly working with Input, and the team is amazing. And doing that work also became familiar with some of those resources, and they really are so valuable and amazing. I highly recommend people check them out. And we do have a little bit of time, and as we sort of discussed before, and it's really quite complementary to maybe speak a bit about the foreign aid freezes and the things that are going on that international level that are affecting drug user networks, harm reduction orgs, etc. internationally. Did you want to talk to that a little bit before we move to Elle?
Yeah, no worries. Yeah, look, I nearly did include this in my presentation because, as you say, Emily, rightly so, it is very complementary to the other issues and work I've been talking about. I don't want to kind of, bore people or treat people as idiots. So, but I think I'm going to kind of go back, kind of give the context to this a little bit, because not everyone, I understand, works in the global space, and it may be more or less familiar to people. But essentially, sort of back in January, the US government, the Trump administration, really just announced these massive what was a funding freeze initially. USAID, which is the big international development agency in the US, and a freeze on foreign aid funding. There were, and so then, drill down, I guess, that sent shockwaves through the entire, international development aid community globally. I mean, just to give you a sense for framing up what will follow is, there's, the US government is, people have been saying, well, why should the US sort of fund, everyone around the world to, whatever. It's like, well, it's part of being a good global citizen, isn't it? And part of the world, and they benefit directly from a lot of this, a lot of the work that is done. With that said, we need to understand that this is a massive amount of the global, um, particularly harm reduction, but health, foreign aid spend, by countries globally, because the US, their economy is so large. Even though they only contribute a really, really small amount of their GDP to foreign aid, in fact, less than many other countries do, the fact that their economy is so massive means we're talking about a huge amount of money. And in terms of harm reduction, we're kind of talking like we've lost potentially sort of 50% of the harm reduction, kind of global harm reduction spend sort of overnight. It's massive, right? So that happened in sort of late January. There was a lot, as you can imagine, scrambling and advocacy to try and respond, often really small organizations trying to do this that exist on a shoestring anyway. And alongside the foreign aid freeze, there was also the stop work order through USAID, and a lot of, they gutted USAID. It's now been dissolved, and what's left of it will be absorbed into the State Department. So it's yet to be seen what all that means. Many people lost their jobs in the US who had been dedicated to this kind of work for decades. But it also meant that USAID, so on the one hand, you've got the funding freeze, and let's say in our space, we're talking about something like PEPFAR, which is the President's Initiative on HIV/AIDS, and that funds so much of the HIV/AIDS harm reduction, by association, Hep C type harm reduction work globally. And so that's a big part of what's caught up here. So that's freezing. And then you've got USAID stop work order and being gutted. And that USAID was often funding the kind of implementation of things. So while PEPFAR might be just funding, say, the drugs and the medications and the harm reduction supplies, USAID are behind a lot of the staff and the infrastructure and all of this. So it's double whammy stuff that's hitting people. When I talk about PEPFAR, PEPFAR in itself is really critical, because it funds so much of the HIV response, and we've all spent decades building that response, and we now have a situation where people live with HIV rather than dying from AIDS, and that's all now completely under threat. The problem with PEPFAR and why this is so wide-ranging and has so many implications for harm reduction in particular is that PEPFAR also is the largest donor to a number of multi-donor programs that we rely on. So I'll give you two examples that are really critical to both input and people who use drugs and harm reduction globally. So PEPFAR is the largest donor to the Global Fund, and the Global Fund is almost the sole funder of needle and syringe programs, some OST, take-home naloxone, all of that kind of thing in low and middle income countries. I mean, these are obviously the countries that are hit hardest by this. They're the countries that receive US, international, foreign aid funds. So PEPFAR is the, so, even though this isn't about the Global Fund in particular, we now have a situation in the last few weeks where the Global Fund has now said they are now starting a reprioritization process, and they've asked all the recipients of Global Fund funds to halt non-urgent, non-essential services, and they're in the process of defining what that means. We've managed to keep harm reduction on the essential list at this point, but that could go at any time. But, you know, it's not just about the sort of, as we all know, it's not just about the needles and syringes or whatever. It's about the, you know, the peer educators, the front line, right, that delivers and makes sure that these harm reduction supplies reach where they need to be and are effective. And what we're hearing, so input in response to the initial freeze, which, by the way, became cuts fairly quickly after. Input launched a rapid global survey. There's a report now. If you go to Input's homepage and just scroll down, you'll see there is a full report on that rapid survey. We surveyed all of our regional and country networks and, you know, associated networks to try and get a picture quickly of what was happening. It's a really distressing picture. But one of the things that survey shows really clearly is one of the some of the biggest impacts are, first of all, that peer workers and on the front line are losing their jobs at rapid rate. They are usually the first to go. And they are the ones that are least noticed, you know, when they lose their jobs, but then they very quickly, it becomes apparent just how critical they are to the front line of harm reduction. So that's already happening. There's an increase in sort of stigma and discrimination as well, as you can well imagine, because everybody is, you know, being encouraged to have opinions in all sorts of directions on what's considered essential and important and a priority, and it's causing all sorts of problems. So there's also situations where, you know, there's low and middle income countries, like, for example, places in Eastern Europe, Central Asia, where perhaps the government might fund some of their harm reduction and maybe funds their OAT program, but they're very conservative governments, even hostile governments, and they see this as an opportunity to double down on, you know, becoming even tougher on drugs. And, you know, so it's encouraging a whole lot of behavior from other countries, including other countries now who have been kind of some of the big donor countries, other than the US, are also now reviewing their foreign aid budgets because the whole environment has changed. Pressures on them to give more, but they're also, on the other hand, this is all tied up with tensions in the world, and so there's governments are starting to put more money into defense and take it out of health, you know, so there's all of it's a really sort of multi-dimensional problem that we're experiencing at the moment. The other kind of funds that are at threat here that people should know about in the context of this webinar is the Robert Carr Fund, which is Input's main source of funding, but is also the main source of funding for most of the regional networks of people who use drugs. So via Input, we do sub-grants through Robert Carr to the regional networks to keep them afloat. And again, PEPFAR is the largest donor to the Robert Carr Fund. So we were sort of, as this all happened, we had just been through a new procurement round for these funds. They go out and they try and raise money to fill, you know, so they can fund things for the next few years. They're now, obviously, the US contribution to those is now gone or very much under question. And so, you know, we now have a situation where Input's 3-year funding agreement has become, you know, a 1 or 2-year funding, you know, that sort of thing. So everything is up in the air. Now, it's a really difficult time. Input is really trying to stay on top of this and is constantly doing more work and advocacy in this space. Stay in touch with what's going on the Input website. You should be able to sort of see our briefings there. We've just done a briefing to the Global Fund on issues around people who use drugs and harm reduction to sort of ensure the advocacy, you know, they're clear on how important this area is. But it's a changed landscape now for sort of international funding for harm reduction and HIV and hepatitis C work, prevention work and treatment and care work. So it's not going backwards. You know, we're never going back to what it was. It is a kind of forever change environment. What it becomes is hard to know. But it's an evolving space, and it's certainly going to be difficult times ahead, I think, for people. But, you know, wherever these things happen, there are also opportunities, I guess it needs to be said. And so Input is very much focused on where those opportunities might be and where we can sort of look to other spaces and other donors and having some success in that space. But yeah, I'm sorry that's a kind of big, you know, don't have slides in front of me and sort of a way of ordering all the information. It's such a huge sort of event that's happening, and it's a little difficult to summarize it in a sentence. But we're just sort of, I guess, to say finish by saying at the moment, Input is really focused in several spaces to ensure that whatever resources continue to be made available going forward, that harm reduction, so NSP, OAT, naloxone, peer-based service delivery and education, those kinds of things are protected in that space. But what is available for that is it's really we don't know at this point, and there's probably no point pretending that we do. Really, it's a really movable thing. So I hope that's helpful, but I'm really happy to answer questions, or others may know more about this than me. Yeah, thanks.
Oh my gosh, thanks, Annie. I almost regret asking because it's just so depressing and scary, but also it's the most I've kind of heard. Like, I really appreciate you speaking to it, even without slides, because it really helps me and others to understand. Yeah, thank you.
Yeah.
And on the work that you've presented, that you've done with Input and your Input team, and also the HRA team, super impressive and valuable. And I just want to say it's so appreciated. Thank you, Annie.
Thank you. Thanks. No worries.
All right, well, we might move on to Elle. Next, I'll just introduce Elle. Well, Ellie Morrison is our Deputy Chief Executive Officer and Advocacy Lead at AVIL. Elle has worked in harm reduction roles, program services since 2001. Her first role was in community development at Melbourne's first primary health service for people who use and inject drugs. And she went on to support harm reduction and the development of drug user organisations across Asia and Australia. Thanks, Elle.
Thanks, Emily. I'm going to share my screen as well, so please let me know when you can see it. And it's on the right setting. Can you see it yet?
Not yet, Elle. Oh, here we go. Yep. Can see that. That's good.
Can you see everything though?
Yeah, sort of seeing it in the format where I can see the other slides down the side there.
And I've already forgotten, even though I've done this a couple of times in the last day, I cannot remember how to do it again.
See if I can. Oh, there we go, Elle. That looks good. Yeah.
Thanks. Yeah, I wanted to start by thanking Annie for that incredibly comprehensive and important presentation. We've been wanting to share that with everyone for quite a while. And then this month was International Harm Reduction Day. And so it was a good opportunity for us to start talking about harm reduction. I am on the wrong slide. That's the wrong actual This is the one I'm showing. Okay, sorry, everyone. Okay, let's try that again. Okay. How's it? Can you see that? No.
Yes, I can see it out, but it's not in presentation format because I think it's just got the slides down the side and also, yeah, now that looks right.
Okay.
Perfect.
Sorry. Okay, so we also have a whole lot of really great questions from people. So I will try and get through this pretty quickly so that we can get to the questions. So what I'll start with saying is that that it's so important that we are leading, people who use drugs lead these responses in our space, in harm reduction, in anything to do with our community, because as we know, stigma and criminalisation and human rights all impact our entire lives. So while we get most of our funding in harm reduction focused on hepatitis C and bloodborne viruses, and that's incredibly important, we also know as people who use drugs that the criminalisation of our communities and our experiences impact on our access to bloodborne virus prevention tools and resources, our access to NSP, our access to testing and treatment, and all of these things just are an evolving kind of a experience for us that we can't just box into one thing. We can't just box it into hepatitis C or NSP. It's all a part of our lives. So to start with, I would like to acknowledge the traditional owners of the lands on which we meet, and Aboriginal people who use drugs are disproportionately impacted by the drug laws and criminalisation of people who use drugs. I'd like to acknowledge elders past and present and the contributions that Aboriginal and Torres Strait Islander people make to our communities and our work, and the incredible people that have come before us and continue to work with us to address the human rights and criminalisation of our communities, the discrimination we face in all its manifestations. It's such a privilege to be able to be a part of AVIL and to be a part of this community. And again, this presentation is going to be focused on why it is that we need to be in leadership positions in these responses, with just a little bit on the work that AVIL is doing so that people might know where we can contribute to trying to address these issues. So Annie already talked in a little bit more detail about human rights. What you might not know is that we're the only developed democracy to not even have a national human rights charter. We do have a few jurisdictional human rights acts, but a national act has not been made part of our constitution. And so we rely on kind of common laws and legislation to give us usually like not the actual rights that we're looking for, but the perceived rights or the kind of implied rights. So we're kind of famous for that in Australia. It's considered a bit of a backwards issue for us. And why it matters to people who use drugs is that our rights are not ensured, and the way that decisions about human rights and how they're defined and enacted often leave out people like us, people who aren't seen as deserving, people who don't always have a seat at the table. There are a few organisations and areas where there has been a focus on the human rights of people who use drugs. But often when they're not led by our communities, there'll be a real focus on health. The types of recommendations around things like drug laws will be about, say, possession offences, and not really about serious law reform that will protect all people who use drugs, and not just like the few that might be able to fit into some of the categories that are seen as more deserving. And so, recognising that these were big issues for our community, AVIL held a Health and Human Rights Summit at the end of last year. So in December, we gathered in Adelaide. There were around about, I think, 80 people. All of our states and territories were represented. We also had some guests from Portugal and from Fiji. We had some key stakeholders and experts from research like Kate Sear, and we talked for 3 days about the laws and the human rights of our community, the impact of the incredibly low funding for harm reduction that Annie has talked about already. 1.6% of the total drug budget is for harm reduction, as many people know. And, you know, there's incredible evidence for the effectiveness of harm reduction in achieving more than, again, like incredible things in terms of prevention of bloodborne viruses, but so much more. Whereas 66% of the budget for drugs in Australia goes to law enforcement, where there's pretty much no evidence that it works in achieving less drug use, and in many cases may actually increase harms for people who use drugs. So we talked about all of these things over 3 days, and it was entirely led by people who use drugs. And from that, we developed a statement. And that statement really focused on these things that are important to our community. Again, like the investment in our organisations, so that we would be able to have a much bigger impact, be able to have much more say in many of the things that affect us. We asked for an investment in our community to be able to support our region. So as Annie was talking about, some of the local countries around us have huge rates of HIV in their communities, really high prevalence of HIV among people who inject drugs, really low access to needle syringe programs, low access to HIV testing, and incredibly low access to the best treatment for HIV. And then hepatitis C is non-existent in many countries. So some of these countries, many of you might have heard about Fiji, and a really growing epidemic of HIV among people who use methamphetamine and are injecting methamphetamine, something they hadn't seen really until about 5 years ago. We met with some local people in Fiji. Some of them came to our summit, and more will be coming to another summit that we'll be holding this year. And they're really keen to learn more, because they've had almost no access to even to education about harm reduction or HIV. They don't know anything about hepatitis C or hepatitis B. Many of them are co-infected with at least 2, sometimes 3 of these viruses, and struggle to get access to treatment and services. We also asked for much bigger investment in evidence-based and innovative harm reduction. So again, we've already heard a bit about the lack of innovative harm reduction in Australia. We've got 2 medically supervised injecting facilities, and they're led in medical ways, not by the community. We have drug checking supported in 4 states now. Yeah, 3 states and 1 territory. But Queensland has lost its state support and is struggling to maintain its services, and none of the drug checking services that we have are really seriously funded. The other kind of, what we would consider to be innovative harm reduction that has been implemented over the last 20, 30 years since we first got NSP is again very limited, often led by clinicians, and rarely reaches many people, has some major restrictions on the types of users who might be able to access them, and would look really different if we were to be leading them. We had a focus on legalizing cannabis, both for medical and recreational use. And again, like we're seeing in our community, that restrictions on the way that people can access it are impacting people who inject drugs or people who are seen to be drug users, so that they can't access the things that other people can access, including medicinal cannabis. We really want to see a strong investment in overdose response, along with HRA. A few of us are advocating for this, and I think Annie's point that it's not a major conversation for people other than us says a lot about how people view our communities. We want to see investment in OST and harm reduction, both in the community and in prisons, and other correction settings. I think we all know people who've had awful experiences in lockups and prisons around their ability to get OST, and obviously there's no NSP in any Australian prison. And we just need investment across the board that recognises the peer workforce and our place leading it. So these were some of the big asks that we had that came out of those 3 days in Adelaide. And we will continue to consult with our community around health and human rights and what are the priorities and actions that we really want to see. We'll keep advocating for our peer-led organisations and for people who use and people who inject drugs to be at the forefront of responses. We want to see scale up, obviously, of funding and support for peer-led harm reduction and harm reduction across the board. And we want to see real action around the barriers that affect our access to opioid dependence treatment, like the ridiculous and non-evidence-based restrictions on how many takeaways people can have, some states worse than others, as well as the impact of restrictions on our ability to access pain relief, medicinal cannabis, and other health and social services. Many of these are structural issues, as well as just individual and organisational stigma and discrimination that happens that isn't based on evidence. It's almost always based on attitudes. And we'll continue to lobby for drug law reform and to do everything that we can to protect the rights of people who use drugs. And so that's where we will be talking to people in our community and trying to make changes, as we have been doing for many years and will continue to do. So thanks, Emily. I hope we've still got some time for questions now so that we can hand over and hear from Benny and our audience.
Thanks, Sal. That was great. I really loved seeing that summary of all April's work. Like, thank you. Well, we do have time for questions, and I've got a few to read out. If anyone's got any more questions, please submit them, and any for L2, that would be great, because at the moment I've got mainly questions for Annie. So Annie, if you're ready to answer any of these, I'll put them to you.
No worries. I'll do my best.
Okay, thanks, Annie. The first question for you, what do you think? Sorry, I'm just getting a notification. Okay. Annie, what do you think about the impact of the drug conventions on our rights as drug users? Obviously, it is an issue, but what do you think?
That's just a small question. Good one. Just a small question to get started. No, it's a very good question. And look, you know, what do I think? I mean, I think that really, for a long time now, a lot of organizations that I've been involved in have been calling for a complete review of the three key, drug conventions, or the single convention and the two that sort of operate with it. And it's completely necessary. As I understand it, there has been, and Ellie may know a bit more about this, having had a bit more recent connection with C&D, but I understand there has been a commitment to independently review I think the conventions. I'm pretty sure that I'm right about that, but I can follow up if others aren't sure of this. But I think there is some kind of commitment that has very recently happened around this, but through C&D, but yet to see any kind of detail on what that looks like and whether it would really result in anything. I think the organisations I'm referring to, when we've sort of said we mean, top to bottom, preferably to get rid of them type review, because there are so many problematic things within those. So let's take the main single convention in particular. Now, admittedly, not all member states are a signatory to this anyway, but, we are, Australia, and tend to follow it pretty much to the letter. And, over the years, people may or may not be aware, but, there's been a lot of pressure brought to bear on Australia at certain times internationally to toe the line of the single convention. Like we tried to, do a heroin prescription trial back in the 90s, and pressure was brought to bear, from outside of the country, but at a political level, to not proceed with that under the terms of the single convention. So I think, there's lots of problems with them. I mean, not the least of which is that the way they frame up drug use, and therefore people who use drugs, as an evil in the opening paragraph. I mean, that's, I laugh, but that's just like unbelievable, that's the kind of opening framing of that convention. And I've said before, and this is drawing on work from someone called Rick Lyons, who did some PhD work around these conventions. And I would recommend, if you're interested in the conventions, and because he actually is a lawyer and has international law qualifications, and he did a really good sort of PhD thesis around the conventions and how the problems associated with them. And one of them is that, that framing of drug use, and by extension, people who use drugs, as a social evil. You don't even see that kind of language in the genocide convention, right? So, I mean, that's just sort of telling you just how over the top these conventions are, and everything through them. It's not the kind of language that we want to see. We've managed to kind of find things to hang things off over the years, but there's many problems with those conventions, and they just need a thorough at least review. Preferably, we need a new way of kind of viewing how we think about, talk about, manage drug use in society, top to bottom, in my view. Ellie may have some other views on this, I'm not sure.
I think you said it, Annie, and there's some more complex questions for you that
Oh, great. Nice. Yay. Okay,
Shall
let's
I?
keep going.
Okay, I'll go to the next question, but thanks, Annie. Great
Mhm.
response. Yeah, the second question for you, Annie, is can you speak to the ratification process that makes treaties legally binding?
Mhm.
I find it perplexing that UN treaties, resolutions, and declarations are generally not legally binding unless they are ratified or reflect existing international law. Yet, the UN Charter is binding on all member states upon joining.
Yeah.
In the context of health and human rights, how can a country justify choosing not to ratify a treaty, resolution, or declaration, particularly when it would appear to be in direct conflict with the core principles and values of the UN Charter?
Yeah. Look, I mean, really good question, or series of questions in there. I don't have any sort of like amazing insights into that, really. I think you've kind of, they're questions, but you're kind of sort of answering it along the way also. So just for those who know, so treaty ratification is a very formal process, right? So signing a treaty is not enough. That doesn't legally bind a member state to a treaty. So signing is almost like an intention of a member state to ratify, but they may not go on to ratify, and that has happened. So treaty ratification is in itself a formal process, and it is only when it is formally ratified by the appropriate process that a member state is then seen to be legally bound by the treaty. And in Australia, the executive government is the only group that can actually ratify treaties. They typically will also go through Parliament. There's a committee, I think, of Parliament that actually reviews all new treaties before they're ratified or whatever. But ultimately, they don't need Parliament to ratify a treaty. It's the executive government of the day that does that. Now, in terms of bindingness, and I did sort of kind of touch on this in my talk a little bit. This is a really perennial problem of international law, really, is this idea of what's the kind of big stick that makes countries or anyone sort of really abide by international law. It really is, for the most part, all about sort of pressure and to do the right thing, if you like. I mean, technically, once a member state has ratified a treaty, they can't sort of, I think the term is they must refrain from acts that would be sort of seen to undermine the objectives or purposes of the treaty. But, again, who's going to really pursue that? That's why it's good to have the committees, the treaty bodies whose job it is to monitor these treaties and to do the peer review process. And that's why that's so important, because really it's all we have. In terms of why a country wouldn't ratify a treaty or resolution or whatever, I mean, that how long's a piece of string kind of thing. There's many, many reasons why countries might not do it, often political reasons, but there can be others economically. There can be all sorts of reasons depending on what the particular issue at stake is. And I think you make a good point around the UN Charter, and if they're refusing to ratify things that are largely consistent with that. I mean, most countries would argue, well, that's a broad document that, is about the sort of operation of the UN itself. And these are specific treaty-based, issues that drill into particular issues, etc. But I don't for a minute pretend this is kind of like a space without flaws and holes. It's a tricky one, but it's kind of all we've got. And I think in the context of what's going on with the Trump administration at the moment, and Russia, some of the kind of flouting, really kind of blatant flouting of human rights and international law that most of us hold reasonably close. What we've got is kind of under threat. And so, even just hanging on to that may be a challenge. So I guess that's all I'd probably say.
I think that's actually a lovely spot to end the webinar too. Thanks, Annie. Thanks for speaking today, Annie and Elle. Loved both the presentations, and yeah, thank you so much.
Been a pleasure. Thank you. Have a good day, everyone.
Yeah, thanks everybody. We'll see you guys at the next webinar.